Welcome to the ASCO University Weekly Podcast. My name is Dr. Alexander Drillon, and I'm the Clinical Director of the Early Drug Development Service at Memorial Sloan Kettering Cancer Center. Each week, members of our expert faculty will present a new episode based on either a self-assessment question, a new drug in oncology, or an ASCO guideline.
Hello, my name is Dr. Cindy Schwartz. I'm the Alan Hassenfeld Professor of Pediatrics at Brown University and the Director of Pediatric Hematology Oncology at Hasbro Children's Hospital in Providence, Rhode Island. I also lead our CHAMPS program for survivors of childhood cancer. I will be speaking about some survivorship issues that should be considered when treating adolescent or young adult patients diagnosed with cancer. The issues faced by this population are often unique, and we need to recognize their special needs. Many of the cancer therapies have risks for late effects. My comments focus on issues related to cancer treatment effects and transition to survivorship care. Our goal in cancer care is not just to eradicate the cancer, but also to promote long-term health. The need for survivorship care first became apparent in the realm of pediatric cancer survivors when the sometimes harsh treatments were noted to affect the normal physical, social, and cognitive developmental pathways. Adolescents and young adults with cancer face these challenges as well as the challenges of transitioning to adulthood, from reliance to parental care to personal responsibility for life choices and health. Survivors and their families are often unaware of the long-term medical risks. Studies that we performed at Hasbro Children's Hospital showed that at the end of therapy, parents of young children with cancer did not necessarily remember all of the chemotherapeutic drugs their children received, let alone have a full understanding of the risks of these agents. Adolescent and young adult cancer survivors may be even less aware of their treatments and of their risks, both because they were not physically present at the relevant discussion and that they may have been relying on their parents to simply take care of them. The challenge for this cohort is therefore great. Without knowledge, it is less likely that they will comply with suggestions for continued surveillance or for health-promoting behaviors that may mitigate adverse effects. Recognition of the late effects of cancer treatment and the need for comprehensive survivorship care has led to the development of survivorship programs. But even institutions with significant expertise in this arena report only 40% return for follow-up. The first step to improve survivorship care must be recognition on the part of the patient that the care is needed. For this to happen, the survivor must be aware of their treatments and the medical risks that they face. We can help young survivors take control of their health needs by being sure that they receive an end-of-treatment summary of treatment and of risks. For those treated as children, the conversations held years earlier with parents must be repeated for the patient, him or herself. Without knowledge, we cannot expect an adolescent or a young adult to fully recognize the need for ongoing care. Use of the ASCO Cancer Treatment Summary or similar tools for all survivors will ensure that they have the basic information. When used in combination with discussion of individual risks, it is more likely that a young cancer survivor will understand the need to maintain medical care and will be able to advocate for themselves so that they receive the care that they need. As AYA patients transition to adult life, the goals of establishing independence from the parental family via relationships, education, and occupational choices are critical and are surely influenced by the experience of cancer. For example, those treated with cranial radiation may need neurocognitive assessments and occupational counseling to achieve independence. For others, reproductive concerns may influence their personal relationships and impact their prior expectations of establishing a family life. New fertility options abound, and they may limit the risk and enhance the likelihood of parenting. ASCO has established guidelines for fertility preservation for providers to peruse, and they have a patient guide as well. Other groups, such as the American Society for Reproductive Medicine, Fertility Hope, and Livestrong, have educational materials available. Secondary malignancy is a most feared long-term complication that survivors may face. We can mitigate the effect of this for some people. For example, early breast cancer screening may save the life of someone previously treated with breast irradiation. For others, recommendations to use sunblock or to avoid smoking may be even more critical in preventing skin cancer or lung cancer than it is for the general population. Risks to specific organs such as the heart or the lungs are individualized based on treatment that the patient received. Individualized counseling can be provided. In addition, groups such as the Children's Oncology Group have educational information geared to specific sites of treatment. As patients look beyond treatment, aging is a risk, as it is for all populations. It may, however, be enhanced for survivors whose organs have already been affected by cytotoxic therapies. Healthy lifestyle choices advocated for the general population may be even more critical for AYA cancer survivors. Exercise, good nutrition, and prevention of obesity impact survival for all and may be even more relevant for cancer survivors. While we as oncologists may not be expert in designing an exercise or weight loss program, our emphasis on the importance of choosing healthy lifestyles for survivors may in the long run increase life expectancy years beyond that achieved with cancer therapy alone.
For more information, visit our comprehensive e-learning center at university.asco.org. Thank you for listening to the ASCO University Weekly Podcast.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.